If your child has ADHD, you've probably been told about a dozen different treatments, some helpful, some not. But how do you know what actually works? Let's clear that up with evidence, not opinions. Hi, I'm 𝗕𝗏𝗂𝗶𝘀𝗵. I'm a licensed clinical social worker who specializes in ADHD, a former school social worker who worked in special education schools, and most importantly, I'm the father of a son with ADHD and learning differences. Everything I share comes not just from professional experience, but from living this every day as a parent just like you. Imagine this. Your child is impulsive, easily distracted, and struggles with following directions. You're overwhelmed with advice. Talk therapy, play therapy, social skills groups, reward charts, mindfulness. It's hard to know where to start. Most parents are never told that ADHD treatments fall into 5 distinct levels based on how effective they are. What I'm about to share is grounded in years of research and clinical review. These treatment tiers are laid out by the Society of Clinical Child and Adolescent Psychology at 𝗕𝗏𝗀𝗋𝗃.org, and they align with the American Academy of Pediatrics official ADHD treatment guidelines. 𝗕𝗏𝗀𝗋𝗃.org ranks ADHD treatments from level 1, works well, to level 5, tested and doesn't work. These tiers are based on how effective treatments are across multiple studies. Understanding these tiers helps you avoid wasting time, money, and hope on things that are not proven to help. Tier 1 works well, strong research support. Behavioral parent training teaches parents strategies to reduce disruptive behaviors and reinforce positive ones. This is the most recommended treatment for children under age 12. I do want to mention that I personally recommend parent behavior training for parents of children over 12 as well, because what I often find in families of children with ADHD is there has been a great deal of parental accommodation, and the research data is very clear that parental accommodation makes behaviors worse over time, not better, which is why I recommend it for parents of children over 12 as well. Behavioral classroom management, effective strategies used by teachers to manage behaviors in school, like a positive behavior support plan. Medication for school age and teens. Stimulant and non-stimulant medications approved by the FDA are considered highly effective for symptom reduction in children 6 and up. Please note, for preschoolers ages 4 to 6, behavioral parent training should be tried before medication. Tier 2 works. Good research support. Teacher consultation and training. When educators are trained to use behavior strategies consistently, kids benefit, especially when it aligns with what's happening at home. Tier 3 might work, some research support. Cognitive behavioral therapy. CBT has shown some benefit for adolescents with ADHD, particularly those aged 14 to 18 who continue to experience symptoms despite medication. However, for younger children, especially under age 12, CBT is not supported by research as an effective treatment for core ADHD symptoms like impulsivity and inattention. Because I have training in cognitive behavior therapy from the Beck Institute, where cognitive behavior therapy was invented, that in order for CBT to be effective, the individual needs to be motivated to participate. If they are not motivated, it's not going to be effective. Tier 4, experimental, untested or under-researched. Mindfulness training, dietary supplements, working memory training programs. These sound appealing, but lack enough evidence to recommend them as primary treatment. Tier 5, tested and does not work. Talk therapy, also known as traditional psychotherapy, doesn't address behavior regulation or executive functioning. Play therapy, popular with younger children, but no evidence it helps with ADHD symptoms. Social skills training. Studies show this does not improve real-world peer relationships. Takeaways. Start with behavioral parent training, the most effective and recommended first step. Avoid unproven therapies, even if they were recommended to you by a professional, that waste time and money because they do not have evidence to support them. Please remember to check the tier level of any intervention before committing. Follow the American Academy of Pediatrics guidelines. They're based on years of ADHD research. Get support. Don't try to manage ADHD alone. I've been doing this work for a long time now, and I know how easy it is to fall into guilt or feel like you're failing your child. And I just want to remind you, you are not a bad parent. I believe that every parent is doing the best they can at any given moment with the resources and information they have available to them. And when I say resources, I don't just mean information. I mean their own mental health and how much they're juggling in their own life. Managing ADHD is hard, and so much of the advice out there isn't based on what actually works. But when you focus on evidence-based strategies, you can help your child build real skills and reduce family stress. You deserve support that works, and so does your child. If you're ready to use what the research actually recommends, check out the ADHD Dude Parent Behavior Training Programs, Capable and Confident for parents of 4 to 7-year-olds, and Scaffolding Better Behavior for parents of 8 to 17-year-olds. Thanks so much for watching. I hope this is helpful, and I will speak to you soon. Take care.